Hello friends, I am Dr. Pawan Kumar, consultant cardiac surgeon at Leelavati Hospital. I have been practicing cardiac surgery over the last 30 years in Mumbai, and during this period I have done more than 18,000 heart surgeries, including coronary artery bypass surgery. More than 12,000 cases, such cases I have done. Today I wish to share you some information about a specialized procedure, what we call is a coronary endarterectomy procedure. It's a very specialized procedure to revascularize the heart by coring out the intima and the media of the coronary arteries. Indications of this procedure is basically where we get the diffuse coronary artery disease, and blocks are in multigrades, starting from 50% to say 80% or 100% occluded vessels are there. Then we do not know where to put the graft because the whole vessel is full of disease. So in such situations, we have to do this specialized procedure. What we do in this coronary endarterectomy procedure is that we make a small incision and separate out the adventitia of the coronary artery. As you know, the coronary artery has three layers: the adventitia, media, and the intima. Intima is the innermost layer. So we core out the intima and the media and separate it out from adventitia. And with the special equipments and instruments, we core out this media and intima throughout the length of the deceased coronary artery till we reach the normal lumen of that coronary artery. Normally, this procedure is done most commonly in the left antedescending artery, less commonly in the right coronary artery, and still less commonly circumflex artery. Sometimes this disease is very extensive in all three vessels, so we have to do endarterectomy procedure in all these three coronary artery vessels. I have a great experience of this endarterectomy procedure. I have done more than 1,000 such cases because of the nature of the disease in our country is so much, is that coronary artery disease is accompanied with heavy diabetes, hypertension, and calcified vessels. So especially after having heart attacks, people do not come to the doctors and follow their advice, and after heart attack the coronary arteries get 100% blocked. Then it is when they come to us with the 100% occluded vessels, and when we find that after thallium or cardiac PET CT scan, that area is still viable with 100% occluded coronary arteries. So we need to do revascularization in that area. But where do we put a graft in after 100% occluded coronary arteries is difficult to know. So that is where this coronary endarterectomy procedure comes in the picture. And with my experience, I can say that this is a very successful procedure if done right. And here I'm showing you a case which I did last week, where LAD, left antedescending artery, was diffusely diseased right from distal proximal to mid and distal most portion of the coronary artery, left antedescending artery. There was no place where I could put a graft, the left intermemory artery graft, in that LAD without having an occlusion beyond the anastomosis. So I took a decision to do endarterectomy procedure in this case. As you see here, this is the angiography where LAD is totally diffusely deceased. So I made an incision between mid third and the distal third of the left antedescending artery, and cored out the media and intima throughout the length of the mid third and the distal third of the coronary artery, along with the branching of at the distal third left antedescending artery. Once we core out the vessel, the key to success is that we see the backflow of the blood coming from the downstream, so that we know that whole lumen is now patent. And once the lumen is patent, we can put any graft. And here I put left internal memory artery on the left antedescending artery after completing this procedure, and it flowed very well. And you see the post-operatively, if you see the ECG is bang normal. So that shows that I have not damaged any myocardium or any other area of the heart, and it has given me a great result. Similarly, one has to understand that this procedure has to be done whenever we require it to be done, because people are afraid, surgeons are afraid, and do the grafting at the distalmost portion of the coronary arteries, where the blood supply will be minimal and the benefit of the procedure will not be given to the patient. So if required, we must opt for endarterectomy procedure. It is with great experience and expertise. This procedure gives you great result, and whenever it is required, it must be done. Thank you very much.